Yes, Mr. Speaker. I think I voted against this bill a couple years ago. It looks like it's been amended and changed for the better. So I just want to bring to the floor for my colleagues. You know, when I got elected in 2010, I was the guy that was outspent, but I was talking about something different. And we talk a lot about people going to the polls, but I think the reason why the apathy, people aren't going out, is not because they don't have 7 or 8 days. I'll be honest with you, I look at campaign literature from both sides of the aisle, and when people are running for office, it seems like they all sound like conservative Republicans. So, you know, there's not a lot of difference between how people campaign. And I think that if we change some aspects of our campaign system, we need to have campaign finance reform. We need to allow more people to be able to come out and run for office. If we have the same old people saying the same old thing, it doesn't sound like most people think there's a lot of difference between the two parties. So I think if we push for reform, we'll actually have more people coming out, whether it's a 1-day or 7 or 8 day voting period. And thank you very much, Mr. Speaker.
Ms. Markey to explain her vote.
Thank you, Mr. Speaker. This is an interesting topic for me because I think of my parents and why I'm here. And my parents would, on election day, my mother wasn't working at the time, but my father would come home. My mother would wait for him, and they would go around the corner to vote. And my father would wear a suit. My mother would get all dressed up, and it was a time of being proud to be able to cast your vote. When I was a very young child, they'd let me in the voting booth with them so I could see how they voted. Well, life has changed. There aren't too many families that can live on one income. So people, wives, or have second jobs in order to help the family. I think every person needs to vote. I think on Memorial Day we have our ceremonies in my community, and people are very proud of the soldiers and the sailors who went off to war. But one of the reasons they've gone to war was to protect our freedom to vote. And I think voting is very important, and I stand by Mr. Kavanaugh's bill, and I really believe the more opportunities people have, the more voters we will have, and that's not going to threaten anybody. Thank you.
Mr. Otis.
Thank you, Mr. Speaker. I actually happen to represent a community that already has early voting. The Village of Portchester, through an agreement with the Department of Justice to resolve a Voting Rights Act issue, came up with some solutions to increase voter access and voter turnout, and so have now conducted in the village, I think probably 5 or 6 elections with an early voting process. It has gone very smoothly. It has provided an opportunity for people to vote a few days in advance if their schedules really would not allow them to vote on the traditional Tuesday. There have been no negative comments in regards to it, and I think it's something that would be of benefit around the state. It is very workable and very positive and provides more access for everyone to vote. And so I will vote today, voting aye. Thank you.
Mr. Otis in the affirmative. Are there any other votes? Announce the results.
Ayes 92, noes 35.
The bill is passed.
Senate 3419C, Rules Report 266, Senator Young, an act to amend the insurance law and the public health law.
An explanation is requested, Mr. Titone.
Thank you, Mr. Speaker. This legislation creates a standardized process for an expedited appeal of a step therapy or fail-first protocol imposed by a health insurer for prescription drugs. This is a common sense pro-consumer bill with bipartisan support. And as many of you know, this bill passed earlier this week unanimously in the Senate across the way here.
Ms. Corwin,
Thank you, Mr. Speaker. Would the sponsor yield?
will you yield, Mr. Tatone?
Of course, Mr. Speaker.
Sponsor yields.
Thank you, Matt. I appreciate that. I just want to make sure I'm understanding exactly what the bill does here. Now, step therapy protocols are utilized by Medicaid, Medicare, most commercial insurers, and my understanding is that they are created usually by some sort of an independent committee of doctors, nurses, and so on that create the actual protocol.
Okay,
What?
well, I want to be clear that,
Okay.
that this bill does not touch any Medicaid or Medicare, anything that's federally funded or self-insured. So really ultimately what this bill does, Jane, is it just creates a expedited appeals process in certain situations for certain patients.
Okay, sure. I guess my point here is that the protocols that are used are created by experts in the field. It's not something that the financial guys in the accounting department aren't figuring it out. The protocols themselves are being determined by doctors and nurses and pharmacists.
Yeah, for the most part, yes, but there are committees that may include, more than just what you mentioned.
Okay, yeah. I think what I saw here was a pharmacy and therapeutics committee staffed by doctors, nurses, pharmacists, and academics.
That's correct.
Okay. So the protocols are created, and obviously from what I'm reading is that it's not only about the cost, but it's also about the efficacy. For example, trying one drug before another for the cost effectiveness, but also for the fact that the first one may be more suitable for whatever condition it is.
Well, that's a great question, Jane, but quite frankly, it's a loaded question. It's a complex question. If I understand your question correctly, you're asking me what the policy is in itself. So often, what can happen is that you have a patient who has a very complex biomedical makeup, so to speak, and they have more than just one ailment. It might be lupus along with, psoriasis, some other diabetes. So it becomes a very complex patient to treat. So the doctor will prescribe one medication, for example, to help with maybe a lupus outbreak, and he or she doesn't want to disturb the rest of what's going on. So then the insurer then has the right to say, well, before we take that medication, we'd like you to try this medication first. And the problem is that not the insurer, the claims adjuster usually, doesn't have the whole picture of the medical history of the patient, what the patient may have already tried on other prescription plans. Mm-hmm. So the insurer then has the right, though, to force this patient to try this medication for a certain amount of time. Sometimes it's indefinitely, until the patient can prove to the insurer that it doesn't work.
Sure.
So that's what, and so all this policy does is give the patient the opportunity to have their doctor say, and the doctor will have the burden of proof to say, look, I want my patient on medication B, and this is why.
And that's where I'm confused, I guess, because my understanding is that doctors already have the ability to do that on a case-by-case basis. So if they have a specific patient who's in a situation such as what you described.
And unfortunately, different insurers have different policies on how the appeals process works. So what this would do is create a uniform policy, number one, but also it would create an expedited appeals process. So often when we have patients with complex conditions, time is typically of the essence. So, when a complex patient presents, on a Friday with an emergency sometimes, a doctor may want to get that patient on a medication immediately. So what this does is creates a mechanism to streamline the process and to also give, for the insurer, it puts the burden on the doctor to say, this is why we need to do it, and we need to do it now.
Okay.
So it just, like I said, Jane, it really creates just uniform between insurers, whether, you know, an answer, denial within 72 hours, I believe, typically, and 24 hours if it's an emergency.
Is it necessary for the patient to have, for example, you said 2 illnesses that are being treated in order for them to utilize this process?
No. But typically, these are the patients who would most benefit from having a uniform policy throughout the state.
Okay. And you give some other conditions here. You said the review agent shall grant the override within 72 hours of receipt of information that includes supporting rationale documentation from a healthcare professional which demonstrates, and then you listed 5 different conditions under which would apply. For example, the required prescription drug or drug is likely to cause an adverse reaction or physical reaction. The required prescription drug is expected to be ineffective. A third one, the insured has tried the required drug. And this one I was a little confused by because you say the insured would have had to try the required drug.
I'm sorry, Jane, can you repeat that?
Sure. The insured would have had to try the required prescription drug or another one in its pharmacological class. So to me, we're getting a little bit away from that then, because now you're saying, well, you don't have to follow the step therapy when you have a drug here that's the required one, but you have something else that you'd rather try instead. So it sounds to me like we're not, like there isn't a real reason to get away from the step therapy in that case.
Well, once again, we're not getting away from step therapy. We're getting a more fair, more uniform appeals process of the policy of fail first for our New York State residents. And I want to point out, you know, think about this, you know, and many of the advocates have been here a number of times, and there was one woman who, you know, went through several months of paying for her own medication because her insurer against, you know, and her doctor saying, please don't take this drug, but her insurer wanted her to take a drug that, in addition to causing, you know, side effects causing drowsiness, irritable bowels, diarrhea, one of the side effects was, well, blood cancer. And the woman was pregnant. And she simply said, I'm not going to fail on this drug. I will not take that risk. So this really gives a patient like Selena here the opportunity for her doctor to say, hey, you know, I know my patient much better than you do. You don't know that she's pregnant when you're telling her to take this drug that may or may not cause blood cancer.
But
So, and it also gives the patient the opportunity to take the medication that his or her doctor is prescribing sooner rather than later.
well, and I would say in that case, if she's pregnant and she's on some medication or she is being prescribed some medication that would make her sick or not work for her, her OBGYN can make the change in the medication as well, because the justification is allowed
But
by
here's the
any
thing.
physician that's treating her.
But here's the thing. First of all, we don't want our New York State residents who are ill and in need of medication to have to jump through hoops. We can agree on that, correct?
Sure, yes, absolutely.
Okay. So what difference would it make whether it's her OBGYN or her doctor? And I never specified in that example which doctor it was that was saying, I want you on this on medication A, and then it's her insurer saying, no, I want you on medication B.
But that's the point. The insurer could say, I want you on medication, we want you on medication B, but the doctor currently, under current law, has the ability to say, no, medication B doesn't work for these reasons, and so I'm prescribing
Yes, but here's the problem. There's no uniform policy. There's no uniform way of doing it. So that, you know, yes, maybe one insurer does it that way, but another insurer may do it another way. Also, if there's no time frame for the patient given in what you're describing. So again, we're not wiping out banning step therapy. We're just giving a clear process for every insurer and every insured in New York State to have a clear, defined process with the opportunity for the doctor to have a quick appeals for their patient. So that's the only thing that we're changing here, Jane, is that, and yes, the hypothetical that you get, yes, it can, but, excuse me, it would be so much better for that patient not to have to jump through hoops and to get the medication that he or she and their doctor agreed on what's best for them, rather than a stranger, the claims adjuster, second-guessing their decision.
Okay. Well, I guess we'll agree to disagree on that. I think the doctors have more input in that respect. And I would say, too, as well,
No,
that...
I mean, if it's the insurer denying the medication...
Except that the doctor has the authority to go back to the insurer and say, no, this patient needs this other medication for these reasons, which is basically what you're doing in this bill, in the sense that you're saying that you have to provide supporting rationale and documentation from the healthcare professional anyways in this process. So you're doing the same thing.
If I'm hearing you, no, because what you're describing is yes, it's an appeals process, but that appeals process can take, doing it without this bill enacted into law, that appeals process often takes months, typically 6 months or more to complete. And this now puts limits on the appeals process. It streamlines the appeal process so that all parties who are, the stakeholders, the patient, knows within 72 hours, 3 days, yes or no, I can take this medication. Mm-hmm. Rather than 9 months later, 10 months later, when the insurance company who controls the appeal process, mm-hmm. rather than when they get around to making the decisions and making the appeal decision.
Okay, sure. Perhaps maybe another bill that would basically take the existing law and just put that time frame on it and say that decision has to be made within it.
This does that. This does exactly that. And that's why, when I opened up, Jane, that this bill has bipartisan support. Senator Young was able to get a unanimous vote in the Senate across the House. So all the stakeholders have been brought to the table on this bill, including the insurers. So this is a bill that has been discussed, compromised. I know I've been working on it for over 6 years. And what you're talking about has been addressed. And this is it, right here, right now.
Okay. Well, I do have, actually, I have 2 pages worth of opposition, and that's what caused me to raise it.
May I ask from who?
New York Health Plan Association, Blue Cross Blue Shield, Pharmaceutical Care Management Association, Unshackle Upstate. Yeah,
it's unfortunate because they helped to negotiate this bill. It's unfortunate at the 11th hour that they would come in opposing it. And, but I would hope you would take note that there are close to 100 organizations statewide who represent the people that we represent that do support this bill. So,
okay, I believe you're talking about the coalition of organizations supporting regulating the use of failed first-step therapy.
But there's also, the New York State Medical Society, and the list goes on and on and on. Like I said, there's nearly 100 of these organizations who represent the people that we represent that support this. And I want to be clear that the opposition that you're talking about came out after the insurers, the industry, was at the table with us negotiating this for quite some time. So to me, it's disappointing that they would do this without even telling me. I think it's bad form, but so be it. Once again, nearly 100 organizations that represent the same people that we represent support this legislation.
All right, well, thank you, Matt. I appreciate your comments. Thank you, Mr. Speaker.
Thank you, Ms. Cohen. Mr. McDonald.
Thank you, Mr. Speaker. On the bill.
On the bill, sir.
I've been here now 4 years, and when I'm not here in the legislature, I still spend time at my pharmacy, and arguably every day, probably 20 or 30 prior authorizations need to be conducted just in our little old pharmacy. Multiply that by the other 5,000 pharmacies throughout New York State. There's a lot going on. And Member Titone had approached me early on about supporting this bill because of my background, I think, and I was a little bit hesitant at first, and I give him and all the stakeholders a lot of credit for sitting down and trying to iron out the process. Let's face it, medications are extraordinarily expensive this day and age. We're making some great advances in medication. We're having some fantastic outcomes. But at the same token, it's incumbent that we have a streamlined process to expedite the prior approval process to address the step therapy situation. Earlier this year, this House and the Senate both passed a bill that allows for electronic prior authorization to be implemented in the future. And I appreciate the support of this body in making this happen, and hopefully the governor will sign it into law. But let us be clear, physicians and patients have to be on the same page. Having a process where we can share information in a very quick, concise, and exact manner is a large step in the process going forward. And I want to thank the member for his dogged support on this bill.
Read the last section.
This act shall take effect January 1st, 2017.
Clerk will record the vote. Mr. Tatone to explain his vote.
Thank you, Mr. Speaker. Just very briefly, I really, this has been a true labor of love, not only from my end, but really from the advocates. I just, would be remiss. I'm not going to name names because there are so many who really help to educate the public, help to educate members on this issue. So thank you to them. Thank you to the advocates in the balcony for all your help. To the chairman of the Insurance Committee, Mr. Cahill, thank you so much for your work on this, and to your staff as well. They've been over the top, just the best. And of course to the Speaker for allowing this to come to the floor. So thank you, Mr. Speaker. I'll be voting in the affirmative.
Mr. Tatone in the affirmative. Should slide down for a second. So if you weren't going to oppose it to get the money from the opposition, what? Are there any other votes? Announce the results.
Ayes 116, noes 0.
The bill is passed. Mr. Morelli.
Thanks, Mr. Speaker. If I could now give my colleagues the next two bills I'd like to take up. The first is calendar 620 on page 61 of the main calendar by Mr. Morelli, and then Rules Report 354 on page 16 of the main calendar by Mr. Abadi.
Senate 7290, Calendar 620, Senator Robach, an act to amend the education law.
We're on debate, sir. Mr. Gant.
Do they have an explanation of the bill?
Pick up your mic.
Do we have an explanation?
An explanation is requested, Mr. Morelli.
Yes, thank you, Mr. Speaker. The bill would authorize two multi-year cost allowances in a 5-year period for 8 projects for the computation of building aid in what's referred to as the second phase of the Rochester School Modernization Project.
Mr. Morelli, is this a bill that we did a couple of years ago? Or something similar to this?
Well, actually, a couple of years ago, we authorized the second phase, which I think was $435 million for up to, I think it was 13 projects under the School Modernization Project. This essentially allows a change in the way we compute the maximum cost allowance to allow greater efficiencies in the use of the dollars, and would allow the school district in the city to benefit because it's a much more efficient way of using the dollars. It's a much more efficient way of doing the construction projects, and it would spare students from being disrupted, from being out of their classroom or out of their school for multiple times instead of a single time where we might have to move them to another school while a project is undertaken. So it allows greater efficiency and use of the dollars under the project that we've already authorized.
Where do we get these efficiencies from? I don't know anything about this. I haven't seen it.
I'm sorry, I didn't hear that.
Where do we get these efficiencies from? Who told you that?
Well, what happens right now under practice and the rules and regulations set forth by State Education Department, when each district in the state, this school, these schools, have a certain amount of capital that can be spent during a 5-year period. It's called the maximum cost allowance. So let's say in a given school, there's a 10-year, in the 5 years, they can spend $10 million during a 5-year period. That's the maximum allowable to draw down the 98% reimbursement from the state of New York. But a project may be $15 million for that particular building, maybe a serious renovation project. So what has to happen under the current law is, let's say it's a 2-year project. The project begins, you go 2 years, you can only spend, let's say if it's $10 million, a $15 million project. So you get $10 million is the allowance. Let's say the project is $15 million. You start the project, let's say it's a 2-year project. You can only spend $10 million, then the project has to end. You have to wait 3 more years for that 5-year period to elapse, and then you do a second project for the additional $5 million. Unfortunately, to do a single project in multiple pieces that way just creates much more expenditures of engineering costs. You have to stop the construction, complete it, start another project. What we propose to do instead is, instead of a 10-year allowance in 5 years, is 20 years over 10 years. So it basically the same amount annually, but wouldn't require you to break a bigger project, which would be done more efficiently, into smaller projects. And also it has the benefit of not disrupting those students. They don't have to move out for the first project, move back in, use swing space, move students out again for the second phase of the same project.
But Mr. Bell, isn't it true in the city of Rochester that these kids are bused anyway? So it wouldn't make a whole heck of a lot of difference?
I'm sorry, I couldn't hear that.
Isn't it true that these kids that we're talking about, who basically comes from my neighborhood and look like me, they're being bused all over anyway?
Well, but they have designated schools that they choose, and you go to a school, you may have to be moved out. There are a number of elementary schools, so you have the school that you choose, the school you go to. You may have to be moved to a swing school for purposes of the construction project. Then you're moved back when that project is done. Then you'd be moved out to another swing school for the second project to be done. And the only reason it's two projects instead of one is because of the rules that SED operates under, which is a 5-year maximum cost allowance lifespan. All we propose to do doesn't cost any more money. In fact, it costs less money because we'll have much more efficient project that doesn't cost the state any more money. It just allows us to do it over a 10-year horizon. And it also doesn't allow any more on a per capita or annual basis. So it really just allows us to do it over a longer time span. And the school district, and I certainly would want to acknowledge the City of Rochester and the Rochester City School District have strongly urged us to pass the legislation because it would just allow the maximum use of state dollars, allow for less interruption of the children, and ultimately produce modern schools, which is what we certainly aspire to.
Well, Mr. Burley, there seems to be a number of, phase one seems to have had a number of problems. From what I can see from the mayor's letter. You have a copy of the letter? And by the way, do you have a copy of the mayor's letter?
I had a copy of a letter that the City of Rochester, the mayor, did send in support of this legislation, yes.
You have, but the mayor also in that same letter, in paragraph 3, I believe it is, the city has been informed of ongoing FBI and state attorney general's investigations of phase one of this program. Isn't that one of the problems that we have, is that we still haven't found out from that investigation what's going on?
Well, I think one of the challenges here is, and I know you and I debated this 2 years ago when we authorized the second phase of the modernization of our city schools, is that there had been speculation that certain parts of the first phase were being investigated by the FBI. But of course, the FBI doesn't indicate whether or not they're doing an investigation. And as I understand it, again, this is all third party, so I feel somewhat uncomfortable about this, is that it related to a specific part of the first phase which really dealt with the minority compliance officer. But that is part of phase one. That person was no longer, actually at the point that we were talking about, it wasn't even involved with phase one any longer, certainly no longer involved with the project, has not been a part of phase two at all. I'm not aware of anything beyond that, and it certainly, as I understand it, doesn't affect in any way phase two, which is currently underway, and it's to some degree being held up now by this 5-year limitation.
But is it? I don't understand how it's been held up. This came from where?
Well, I would refer to a number of things. First of all, I have copies of letters from the Rochester City School District, a letter signed by all 7 members of the school board, which talks about the amount of dollars that would be saved here and therefore go to greater use in terms of the ability to do more work for the same amount of money. It's millions of dollars, and I could certainly go through school by school and talk about how much money they save at each project, but I frankly trust the city school district and the city to give me information on what they think is the most effective use of the dollars, and both have opined that this bill is something they very much want to see passed.
Well, that seems to be one of the problems for me is there's a school right behind my house. I can clearly see out of it's called the Inner Loop. I'm sure you know where School 58 or School 14 used to be. And at that school, you can see that the bedrock is only about a half a foot to a foot beneath beneath the beneath the topsoil. Yet they had to have change orders at that in order to do the building. What I didn't understand then, and I do some of the construction work myself, I didn't understand then, I don't understand now why it is that they had to have a change order when that should have been picked up in the first phase. Number two is these schools were being remodeled without having air conditioning put in those schools, and later on it was remodeled. The same construction people are involved in many cases with these schools today. Now, it seems to me that I should not be trusting those numbers are given to you by the school district when, in fact, they messed up the first phase of the program. That school behind me, I think, was overspent by some $23 million. Did they finish all the schools during the first phase?
Well, I mean, you raise concerns that have been expressed publicly, that have been aired publicly, and I do want to just comment briefly. And obviously I'm doing this at the request of the city school district and at the request of the city. But I think what you're referring to, and it's certainly something that has been aired, is that, for instance, at one point we had a superintendent who's no longer in the district who wanted to reform the way that the schools are organized and move from a traditional K through 6 to K through 8, and so spent money in one of the schools to accommodate his vision of the school district. Change orders were needed to accommodate that. The next superintendent was very much focused on summer learning loss programs, and so after designs were done, you rightly point out, decided that they wanted a change order to air condition one of the schools that would have the summer learning loss programs at that school, and so they added air conditioning. I only say that to stress there's some programmatic changes which have caused change orders to occur, and that has, as I understand it, by the district, and they acknowledge this, caused them to reorder the schools in which the schools that they work on and the order in which those schools are done. I think that's probably just something that would happen in any school district of this size, where where you see different priorities by different superintendents, by the leadership of the school district. It's not to say that the money was wasted, it's just the priorities changed, and therefore the order in which the schools were done. That's phase one. I think phase two, they've seen significant changes in the organization of these schools, but they're looking to make sure that we maximize the dollars that are available to us, and that's why this legislation before us is here. And respectfully, we litigated or debated rather these issues when we authorized this 2 years ago, and you and I went back and forth on these questions. The bill before us right now, though, deals very narrowly with whether or not we can expand the maximum cost allowance to cover, instead of the 5-year period, a 10-year period. So the modernization program is well underway. The question is whether we'll be able to maximize state dollars for the uses of educational facilities that will benefit the children in the city of Rochester.
Well, but the fact still remains that on phase one, is stage one completed?
I'm sorry.
It's phase one completed? How many buildings were you supposed to do in phase one?
Yeah, I think they are nearing completion on the projects in phase one.
And none of this money that we're talking about now will be spent on buildings in phase one?
That's correct. This is all.
What about Charlotte High School?
I don't know if it's one of the projects here. I think it's Monroe is the primary one, Monroe High School, and their concern is they would have to split that project into two distinct projects and have to wait to finish it. So they would finish the first part of the project because it's all they can spend over the 5-year horizon in the first 2 years, then wait 3 more years to start the second half of the project. What they would rather do is do the entire project in one fell swoop And look, I respectfully, you know more about construction than I do, Mr. Gant, but I suspect we can all agree that to do a project in one piece is certainly more efficient and less expensive than having to divide it up into smaller pieces.